Hi, my name is Amy Bailey, and I'm a program manager with SafeStates Alliance. I am joined today by Amy Schlotthauer with AES Consulting, Al Johnson with Vermont Public Safety, and Haley Boyle with NYU Langone Health. We look forward to telling you a little bit more about the work we're doing to connect voting and public health and things we've learned throughout our process of working to use data for prevention. So, our agenda for the next 30 minutes includes looking at how this project came about, the injury and violence prevention ecosystem, as well as an overview of the work that's been done throughout our projects for voting safety. Then we'll hand things over to our pilot sites to highlight the great work that they've done over the past year. So, how did this work get started? How did this connection with public health and voting come about? Well, in 2018, SafeStates Alliance started working with the National Association of State Voting Law Administrators, or NASVLA, who had Coast Guard funding. And this started our three-tier recreational boat occupant injury surveillance project. The first tier, this project in 2018, consisted of a roundtable discussion with a group of recreational boating and public health injury prevention experts who really came together to identify surveillance gaps and develop a set of recommendations to improve boat occupant injury surveillance. So these recommendations then served as a guidepost for the work of the Injury and Surveillance Work Group, or the ISW, that was convened in Tier 2 of the project from 2020 to 2022. The ISW work group developed a recreational boating incident definition fact sheet and technical brief to guide state health departments in analyzing their syndromic surveillance data, which is emergency department data. Tier 3, we worked on piloting these recommendations and the work of the ISW with Washington State Department of Health and Washington State Parks and Recreation. Out of that project, a manual was created for state public health experts and voting law administrators to provide some guidance on either initiating or enhancing their voting injury surveillance data in their jurisdiction. This pilot kicked off our current three-tier project with the Coast Guard, and starting in 2025, we engaged with pilot sites, Vermont and New York, to test the data linkage and analysis work from Washington, and then take that data and move it towards prevention. So you'll hear more about both pilot sites a little bit further on in this presentation. So one of the things that we learned as we continue to work on this project really is that partnerships were key between voting and public health. And that really continues to maximize the expertise that both groups are able to bring to the table. So how do we continue to increase these partnerships? Well, one tool that's available as we continue to expand not only the number of partners, but the types of partners we're working with is the injury and violence prevention ecosystem. This ecosystem model helps illustrate how everything around us, so people, places, systems, and policies, really work together to influence and shape outcomes. The injury and violence prevention ecosystem highlights the primary functions and complementary roles of federal, national, state, and local agencies in improving health and safety of communities. So there are tools online that take you through the roles of each of these agencies, which you can find through that QR code on the screen. And some of these roles may seem similar or duplicative, but each agency really does provide a unique perspective so that we can maintain this really balanced approach and have a well-coordinated system. So our project with the Coast Guard is such a beautiful example of an ecosystem at work. So the Coast Guard is a federal agency that provides grant funds and technical assistance to SafeStates Alliance, a national organization, to work on recreational voting data analysis and prevention. So the Coast Guard and SafeStates then also work with state agencies like Vermont Public Safety and NYU Langone Health, And both these agencies work with their community partners on their data analysis and prevention while continuing to connect with federal, national, and state partners. This online tool is a really nice overview of key sectors and their roles, functions of each sector, and other resources such as mapping out injury and violence prevention and data. And you can access that on the QR code. And with that, I'll turn things over to my colleague, Amy Schlotthauer.
Thanks, Amy. So you may be wondering, what are we talking about when we say injury and violence prevention? Well, in the context of boating, we're really talking about injury prevention. And a lot of us kind of default to thinking about what on this slide is referred to as upstream prevention. So stopping harm before it happens. What we are trying to encourage you with this presentation and the examples in New York and Vermont is to expand your thinking about prevention in these other two ways. So when we talk about prevention, we can also talk about midstream prevention, which is keeping people safer when risk is already present, or downstream prevention. And that is what we do to respond after someone is hurt to help them heal. Really, we need prevention at all three of these levels to make boating safer for everyone. Next slide, please. So if you are not familiar with the terminology upstream, midstream, and downstream, you may be more familiar with the terminology primary, secondary, and tertiary prevention. Doesn't matter which words you use, these are both the same concepts. So primary prevention is, again, an intervention that prevents the injury from occurring. We are all familiar with life jackets as a great example of primary prevention as they prevent drowning. Some of the other interventions that you'll hear about later with our case studies can be classified as secondary or tertiary prevention. So secondary prevention is, again, the intervention that prevents an injury from becoming worse. Our colleague Haley from New York is going to talk about the Stop the Bleed program, which is a great example of secondary prevention. Tertiary prevention is an intervention, again, that decreases the impact of an injury. So one example we might think of with boating injuries is prompt response on the water by emergency medical services. Next slide. It's also important to think about a broad spectrum of prevention. So many of the players involved, Amy already mentioned with that ecosystem. And we might be really familiar with the blue and purple levels on this slide. So we're really great at strengthening individual knowledge and skills through boating safety or promoting community education with different educational offerings. One of the exciting things that you'll hear about later from Haley and Al is some of the other ways you can work on prevention through educating providers, fostering coalitions and networks, changing organizational practices, and influencing policy and legislation. Next slide. You also can consider where to direct your prevention efforts. So we automatically kind of think of people as one of the places that we can direct efforts through life jacket campaigns, and these can include drivers of boats, passengers of boats, or people in the bodies of water outside of boats. You can also think about how vessels and the equipment can be modified for safety. So a lot of times at different conferences, we hear about manufacturers working to change propellers to minimize the impact of any injury. You can also think about the bodies of water, so rivers, lakes, streams, oceans, or other aspects of the physical environment that can be modified for safety, as well as the social environment. And this can include laws and policies that influence boating, the use of alcohol and drugs by boaters, and attitudes towards boating and safety devices. Next slide. So I have just given you a lot to think about in terms of prevention in just a couple of minutes. So we wanted to introduce the Haddon matrix as a really easy, useful tool that captures all of the information I just told you in one easy table. So this table combines those levels of prevention, so primary, tertiary, or secondary, as well as where the action is delivered. So, are we talking about people, vessels, the physical environment, or the social environment? Haley and Al are going to talk about some very specific examples that fall in the different quadrants of both of these levels of prevention and where the action is directed. And if you use the QR code on your screen, we have already been working on a Haddon matrix for boating injury prevention throughout the life course of this project. So there is a completed table that you can consider when planning your own prevention efforts. Next slide. So that brings us to our pilot projects for the Using Data for Action project. The goal of using data for action, leveraging enhanced recreational boating data for prevention, was to support the United States Coast Guard, state boating programs, water safety coalitions, and state injury prevention programs in improving the actionability of boating injury-related data. So the importance of looking at your data to understand where your jurisdiction has the most injuries or what is causing injuries and deaths related to boating can then direct where your prevention resources are used. Next slide. So as we've already kind of alluded to, we've had 2 pilot sites in New York and Vermont who participated in this second phase of the project to improve the use of existing recreational boating injury data. And now Haley Boyle is going to talk about the work done in New York, followed by Al Johnson in Vermont in this exciting project. Haley?
Thank you, Amy. So, hi, my name is Haley Boyle, and I'm the Injury Prevention Coordinator at NYU Langone Hospital Suffolk, located in Patchogue, New York. So, as the Injury Prevention Coordinator at a trauma center, my job is to look at injury trends that we see in the hospital and create and deliver programs to the community to help prevent those injuries to keep people safe and out of the hospital. So, for our portion of the project, we focused on improving our understanding of non-fatal recreational boating injuries across New York State. From our work at NYU Langone Hospital Suffolk, it became clear that these injuries are often underrepresented in the existing data systems. In collaboration with our partners, we developed action plans to strengthen both data collection and prevention efforts. Specifically, we aim to better understand reporting accuracy, identify injury trends, and uncover opportunities for targeted prevention efforts. Next slide, please. So this work was led by our team at NYU Langone Hospital Suffolk in close collaboration with our sister hospital in Nassau County on Long Island, which is NYU Langone Hospital Long Island. And we also partnered with the NYU Langone Health Strategy Planning and Business Development team, who supported the data analysis for this project using available resources from the enterprise. Together, this collaboration allowed us to connect clinical data with system-level planning and prevention initiatives. Next slide, please. So a large focus of this work was comparing BARD data, which we know captures reported boating accidents, with healthcare data to get a more accurate picture of boating injuries across New York State. So one key takeaway from this project is there's no single source of data that tells the full story. And this is why comparison is so important. Starting with the BARD, we know that non-fatal injuries are sometimes underreported. Submissions from both the public and law enforcement can be inconsistent, and many data fields are incomplete. However, BARD does have many strengths. It captures detailed information about each accident, including the exact location, contributing factors, and environmental conditions. This information is typically not available in our healthcare data. But to better understand the full scope of the injuries that people are sustaining in boating-related injuries, we looked at the SPARCS data. SPARCS is the statewide planning and research cooperative system. SPARCS is New York State's all-payer database of hospital and emergency department visits. This means that it captures patients treated for injuries in hospitals and emergency departments across New York State. When we compare BARD data to SPARCS data, SPARCS identifies many more boating-related injuries than BARD. But SPARCS also has its limitations. It relies on ICD-10 diagnosis codes. This means if the injury is not coded as boating-related, we will not be able to find it. Additionally, SPARCS data only provides the patient home address zip code rather than the actual zip code of the boating incident as provided in BARD. Boating-related injuries are also not always coded consistently, often because codes don't affect reimbursement or because clinical documentation is incomplete. Overall, these findings highlight the importance of integrating multiple data sources. BARD gives us rich details about the accident itself, while SPARCS captures much more information about the injuries and captures those that might otherwise go underreported. So combining them provides a much clearer picture to guide prevention efforts. Next slide, please. So as we previously mentioned, we identified significant discrepancies across the data sources. So there was a significant variance between injuries reported in the SPARCS, those reported in SPARCS and those reported in BARD. Over a 3-year period, SPARCS showed over 1,500 individuals presenting to healthcare systems in New York State with boating-related injuries, while BARD reported just 244 injuries in that same time period. Common to both the data in the BARD and the SPARCS, we found that children aged 6 to 13 represented the highest risk group for injury. Additionally, according to the BARD, we found that the leading contributing factors included operator error, followed by weather-related conditions and machinery issues. Geographically, high-risk areas included the Long Island Sound, the Hudson River, and the Great South Bay. Regions that are critical for our prevention efforts going forward. Next slide, please. So a little more about our key findings. So we were able to gain an even deeper clinical insight by examining our healthcare data a little bit more closely. Specifically, we reviewed our trauma registry data from the 3 trauma centers within the NYU Langone Health Trauma System. For those who are not familiar, trauma registry data is a detailed record of patients treated for traumatic injuries in trauma centers, including the nature of the injury, the treatment provided, and the outcomes of the patient. By analyzing our internal trauma registry, we identified additional gaps in documentation and coding. For example, only 52% of boating-related injuries recorded in the trauma registry were also recorded as boating injuries in the SPARCS data. This underscores the ongoing challenges of accurately capturing these injuries, even within our healthcare systems. Trauma registry data also has its limitations as it only exists at hospitals that are identified trauma centers, and also we do not have direct access to the trauma registries of other trauma systems outside of our internal system. So for this project, we were only using NYU trauma registry data. But further review of the injury patterns from the trauma registry data confirmed that the most common injuries from boating-related incidents continue to be lacerations, when drowning continues to be the leading cause of death. Next slide, please. So a little bit more about the key successes of this project. So a major success of this project has been the strong collaboration between healthcare and public health partners. These partnerships helped us identify gaps in reporting, documentation, data sharing, and take steps to improve how these systems can work together. More accurate and complete data ultimately supports more effective prevention efforts. Through this project, we also identified scalable prevention opportunities. As mentioned prior, we have integrated programs like Stop the Bleed into boating safety initiatives to address one of the most common injuries that we found in our data, lacerations. Stop the Bleed trains bystanders to respond to bleeding emergency, which is especially important in boating incidents where help may not be as close as it typically is when you're not boating. In addition, our programming has focused on other key safety topics, including life jacket use for drowning prevention, safe swimwear colors, boating safety laws, and more. We are also planning educational sessions with trauma registry professionals and coders who put the actual data into our systems to improve coding accuracy and data quality. Our outreach programs, which include our Stop the Bleed, life jacket training, have been successfully implemented through skills stations at Barrier Island beaches close to us on Fire Island, as well as the New York Boat Show at the Javits Center most recently. We hope to expand these programs in the coming months to more boating related entities, including boat rental sites, marinas, Barrier Island fire departments and EMS agencies, and more. We also plan to expand these initiatives across New York State through our partnerships with other trauma systems. Additionally, we plan to improve the collection of boating-related injury data, as mentioned, by working with our coders to enhance their skills and emphasize how accurate coding directly supports effective injury prevention initiatives. So, in summary, this project highlights the power of collaboration, data integration, and targeted prevention. By combining multiple data sources, identifying gaps, and implementing community-focused programs, we are better equipped to understand and prevent boating-related injuries. Our goal moving forward is to continue improving data accuracy, expand our injury prevention initiatives, and ultimately keep more people safe on the water. And with that, I'll pass it over to my colleague in Vermont, Al Johnson.
Thanks, Haley. Hello, I'm Al Johnson, and I spend a lot of time on and in the water. I grew up on Cape Cod, and I'm a lifelong boater and surfer. I was raised by a dad who was a search and rescue coxswain in the Coast Guard Reserve, so boating safety has always been a big part of my life. I just started the third year in my current role of Boating Law Administrator, or BLA, for the state of Vermont. There's a BLA for each state and territory, and in this role, we each oversee the recreational boating safety grant provided to each state by the U.S. Coast Guard. I'm a civilian in a position that's located within the Marine Division of Vermont State Police. I've also worked for 20 years in Vermont state government. My work prior to this role included 15 years at the Vermont Department of Health conducting budget management, granting, contracting, procurement, and financial operations in the Chronic Disease Prevention Unit. And during that time, I was also the logistics chief of the VDH during the COVID response. My first 3 years in state government, I was a budget officer for the Vermont Department of Corrections. I'm an active member of the National Association of Boating Law Administrators, which we call NASBLA, where I'm the chair of the Finance and Grants Committee and a member of the NASBLA Leadership Academy class of 2025. NASBLA is a member-driven national nonprofit that improves recreational boating safety through national standards, education, and policy. So as I dug into my work, I found that this is the thing. Boating safety is injury prevention. It's the preventable behaviors like wearing a life jacket, operating a vessel at safe speed, and keeping the deck of the boat in order. It's surviving the unseen dangers, including cold water immersion and alcohol or drug-impaired boaters. It's also about being proactive versus reactive, like when you check the weather, file a float plan, and maintain an appropriate lookout. It's about completing a boating safety education course. It's all the things that ensure that everyone makes it home from a day on the water. So the Vermont project started like this. In April 2024, I was fairly new to my position, and I was invited to take part in the series called Recreational Boating Safety, Using Data for Action Community of Practice, that spring and early summer. And I found some of my people. Through the series of presentations, I made connections with Amy Bailey and Amy Schlotthauer. I met Derek Van Dyke, who I was just introduced through NASBLA, and his team from Washington State, who conducted the first data for action project. So the highlights were, I was hooked on the work, it all made sense, and then an RFP for new projects got released. I thought that since a big state like Washington had conducted this type of project, that it would make sense to see if we could get similar results from a small state like Vermont. So I did. I applied. I worked with my colleagues at the Vermont Department of Health on my proposal. They're amazing partners and friends. I talked my high-ranking state super boss into it, and it worked. We received an award. The project, expanding and refining recreational boating safety data in Vermont, was officially a thing at that point. Next slide, please. So in our initial goal, we would expand the evidence base around recreational boating injuries in Vermont. We already knew that the U.S. Coast Guard boating accident reporting database didn't provide a full view of all the incidents and accidents occurring on the water, and we wanted to determine how wide that disparity of information was. Goal number 2 is we would collect and analyze a wider range of data about recreational boaters. The folks at VDH and I put our heads together and made a list of existing and additional data sources to use, including the electronic surveillance system for the early notification of community-based epidemics, that's known as ESSENCE, the Vermont Uniform Hospital Discharge Set, Vermont Vital Statistics, boating accident reporting databases, and our Siren EMS data system. Goal 3 was we'd report the story that the data told us. So in phase 1 of our project, we determined our analysis period. We did an initial query of the BARD system and determined that our analysis period would cover a 5-year stretch. This was the years 2019 to 2023. We looked into whether we needed to write MOUs and data use agreements. This step was very straightforward and turned out to be pretty simple. Due to Vermont's size, the state health department is different than most large states. There are no county departments in Vermont. There's just a statewide public health department that includes district offices in all the counties throughout the state. And most are co-located with our Agency of Human Services partners. VDH had well-established existing relationships both inside AHS as well as with other state agencies and nonprofits. All of the relationships already existed. Next, we developed an aquatic injury data dictionary of terms. This was combined with existing syndromic surveillance information for use in the data gathering process in these alternate data sources. Next slide, please. In phase 2, we reviewed the BARD data. We compiled data from the other sources mentioned earlier, and that's a big go. Yay, that was a lot of work. It was a very deep dive, and they performed valiantly. I'm really impressed with what they know and how they execute their work. During phase 3, VDH performed a lot of analysis work. They completed the analysis of all data that was gathered. Upon completion of this section, we convened with the full team to review the data and come to a collective understanding of what the information was telling us. Next, we identified primary topics for the future, priority populations to work with, and risk reduction strategies to implement. Next slide, please. So, some of the highlights of our project include the following. People experiencing a high prevalence of boating-related incidents and injuries in Vermont include males, and this is for ED visits and hospitalizations, people aged 25 to 44, and people identifying as white and non-Hispanic. That's through ED visits. People experiencing a higher prevalence of boating-related mortality in Vermont include males, people aged 65, people identifying as white and non-Hispanic, and people who do not wear a life jacket. Boating-related incidents in Vermont are most likely to occur, surprisingly, on Tuesdays, followed by Saturdays, in the summer months, during the day, and on Lake Champlain, our biggest body of water. But to add to similar nationwide data, the fatalities verified through Vermont Vital Records 75% of the victims were not wearing life jackets. Next slide, please. Our next steps include identifying patterns of risky behavior, designing targeted interventions aimed at the most at-risk boaters, assessing how those interventions are working, and then leveraging this new information to advocate for improvements in boating safety law in Vermont to enact policies that address the root cause of injury and death on the water. And then we're going to improve boating safety practices and public health outcomes. On a final note, as part of this work with the assistance of my partners at the Vermont Water Safety Action Committee, the Vermont legislature is currently reviewing a proposed cold water life jacket law that would mandate the use of life jackets during the cold water boating season from November 1st through May 1st each year. Bill S-172 has been passed out of the Senate Committee on Transportation and is currently being reviewed by the House Committee on Transportation, where it's receiving broad bipartisan support. Given this widespread support, S-172 is expected to pass and become law on July 1st, 2026.
Here are some QR codes to our social media, and thank you to all of our speakers today who have talked about your projects and who have worked on these projects over years. This has been such an exciting time to continue facilitate and grow these connections between boating and public health, and we are really excited to get to present for you today. Again, these are some QR codes to some of our social media. We post our reports there. We post things that have occurred as well as other public health happenings. So thank you for having us.